Alrighty, we're recording. So this is video 4 in the 6-part video series about ARDS and prone positioning. So in this video, we're going to talk about ARDSNet protocol. My name is Lexi Graham. So we have inclusion criteria for ARDS. The PF ratio is less than or equal to 300. Bilateral, patchy, diffuse, or homogeneous infiltrates with consistent pulmonary edema might be shown on your X-ray, and then no clinical evidence of left atrial hypertension. The initial ventilator setup would be to calculate predicted body weight. So males and females are pretty similar. Males are 50 plus 2.3 times inches over 5 feet, and females are 4.5 plus 2.3 times inches over 5 feet. Next, you're going to select any ventilator mode, set the ventilator to achieve initial tidal volume of 8 milliliters per kilogram of predicted body weight. Reduce the tidal volume by 1 in increments of 1 at intervals of less than or equal to 2 hours until the tidal volume is about 6 milliliters per kilogram of predicted body weight. Set the initial rate to approximate baseline minute ventilation, but not greater than 35 beats per minute, and then adjust the tidal volume and respiratory rate to achieve a pH and plateau pressure goal. This is just the oxygenation goal. I just wanted to throw this in here. I got this from the ARDSNet website. So the oxygenation goal is PaO2 of 55 to 80 or SpO2 of 88 to 95%. You're going to use a minimum PEEP of 5 centimeters water pressure and consider incremental FiO2/PEEP combinations, such as either a lower PEEP or higher FiO2 or a higher PEEP and lower FiO2, as we are showing in these graphs right here. The pH goal is 7.3 to 7.45 for acidosis management, which is pH less than 7.3. If the pH is 7.15 to 7.3, you're going to increase the respiratory rate until the pH is greater than 7.3 or the PaCO2 is less than 25. And then, again, the max respiratory rate is 35. If the patient is less than 7.15, increase the respiratory rate to 35. If the pH remains less than 7.15, the tidal volume might be increased by increments of 1 until the pH is greater than 1.5. And then the target plateau might exceed 30. You can also give sodium bicarb for acidosis management. And then as far as alkalosis management, that is the pH that is greater than 7.45. You're going to decrease the ventilator rate if possible. The IE ratio goal recommends that the duration of inspiration be less than or equal to the duration of expiration. And then finally, the plateau pressure goal is less than or equal to 30 centimeters water pressure. Check the plateau by doing the 5-second inspiratory pause at least every 4 hours and after each change in PEEP or tidal volume. If the plateau is greater than 30, decrease the tidal volume in increments of 1 until 4 milliliters of kilogram until the 4 milliliters per kilogram is achieved. If the plateau is less than 25 centimeters water pressure and the tidal volume is less than 6 milliliters per kilogram, increase the tidal volume in increments of 1 until the plateau pressure is greater than 25 or the tidal volume is 6 milliliters per kilogram of predicted body weight. If plateau pressure is less than 30 centimeters of water pressure and breath sacking or dysynchrony is occurring, you can increase the tidal volume by increments of 1 to 7 or 8 millimeters per kilogram. If the plateau remains less than or equal to 30. And then that is all for this video.